Hello, and welcome to Health Talk, a show where we dive into common health challenges with local experts to bring you the information that you need to live your best, healthiest life. My name is Dr. Desmar Walks, family physician and local health authority for Austin-Travis County. Today we're talking about how to have your healthiest pregnancy possible. Pregnancy is that time of uncertainty and worry for some. Many first-time mothers and even those who've been pregnant before may not be aware of all the aspects of prenatal health. By discussing health issues, women can learn about potential risks and how to avoid them, potentially preventing complications during pregnancy and childbirth. Ultimately, better knowledge and care during pregnancy can lead to healthier mothers and babies, reducing complications and improving overall outcomes. To discuss healthy pregnancies today, we have a very special guest, Dr. Cberryroberts. Thank you for being here, Dr. Roberts. Dr. Roberts is a board-certified doctor of obstetrics and gynecology and a member and fellow of the American College of Obstetrics and Gynecology. In addition to serving her patients with Austin Regional Clinic, she is an affiliate faculty member at the University of Texas at Austin Dell Medical School. She serves as a consultant for the Texas Medical Association's Committee on Behavioral Health, and she advises pre-med students with the National Medical Association. She's also an alumni board member for the Millsaps College. Welcome, Dr. Cberryroberts.
Thank you, Dr. Walks, for the introduction, and thank you for having me on your show today.
Really excited to have this conversation. Tell us a little bit about how you got your start in women's health.
For me, if you'd ask a friend of mine, of someone who grew up with me, they'd say, "Oh, I just knew you would be a pediatrician. That's all you ever talked about." And that's true. And medicine is that world of there's a little bit of everything, and you try and find your niche. And my niche was seeing myself grow with my patients and being able to take care of women through many stages of their life. And that was the drawing force that sealed the deal for me. And obstetrics and gynecology, women's health.
Yeah, Good. What are the most important steps you think a woman should take when planning for a pregnancy?
I think it is never too early to think about your family planning timeline and try not to let it sneak up on you. And careers and life happenings and lifing, how people, say it a lot today, can make 2 years, 3 years, 5 years fly by pretty fast. And so I think, number one, give thought to that timeline in your 20s, in your early 30s, and make routine care a priority is something I would really want to focus on. It's not just about getting pregnant and getting to that point. There's a lot happening with you before then. So those routine visits where we're staying on top of weight management, nutritional intake, exercise, blood pressure, diabetes risks, pap smears, breast exams, you name it. That's all a part of you trying to present your best self to trying to conceive and start your family. So make that a priority along the way. And preconception consultation or visit. Visit before you get pregnant. It's the time to try and create a relationship with someone that you could see taking care of you through your pregnancy. And that does not have to start at the 6-week, 8-week, 10-week mark after it's already done. There's some relationship building and some learning that can happen in advance. And so it is formally referred to as a preconception visit or preconception consultation. Make an appointment with an OBGYN, have someone that you have established care with, and start having those conversations early on about when you see yourself going down the path of trying to have a baby.
Right, and making sure that you're taking care of yourself.
Absolutely.
Yeah, how often should pregnant women schedule prenatal checkups, and what typically happens during that visit?
The really integral one here is you have a positive pregnancy test at home. You get on that phone and you schedule a prenatal visit very early on in that first trimester. First trimester is up to 14 weeks. So technically up to 13 and 6/7. Don't remember that. Up to 14 weeks is considered first trimester. And the reason being, you want to get verification that you have what appears to be a normal developing early pregnancy. Start having those conversations about any risk factors that you may have in pregnancy, genetic testing, labs that we need to get done early on. And depending on the state you live, we're having this conversation in the state of Texas. Let's be real about it. I want you to know that you're pregnant as soon as possible, so that if you are unfortunately faced with something that's not ideal, we leave as broad a range of options open to us as possible, whether we're doing or proceeding in our own state, another state, that doesn't matter. Knowing as much as you can early on, and I say 8 to 10 weeks is when most offices are going to schedule that very first visit, and that's first trimester. Mm-hmm. Get seen, get confirmation of your healthy pregnancy, and start that monitoring. And about every 4 weeks is when most patients are going to be seen, between knowing that you're pregnant up to about 28 weeks. That's the third trimester. Okay. And then after that, visits are more frequent. We want to see you more every 2 weeks. And then when you get to 36, 37 weeks, oh my gosh, you're almost to the home stretch. You're having weekly visits. Every visit is an opportunity to check your baby's heart rate, sometimes check growth of the pregnancy and how the baby's doing, check your blood pressure, your weight, any symptoms, nausea, vomiting, headaches, changes with your vision. Every opportunity is an opportunity for us to see you, lay hands on you, give you reassurance when, hey, things look great, but identify something also that may be a yellow flag or red flag along the way.
So true. And can you talk a little bit about some of the common misconceptions about what you should eat and whether you should exercise during pregnancy?
We have to be careful with patients who come into pregnancy and they're like, oh, I didn't lose as much weight as I wanted to beforehand, so I'm going to go on a diet now. No, not a good idea. The conversation should be centered around, let's adjust our weight goal based on your starting BMI or starting weight in this pregnancy, but dieting and trying to limit your weight to an extreme is not healthy for you, not healthy for the baby. So that can sometimes be a misconception. The other is, oh my gosh, I've never eaten this much in my life. I'm hungry every 2 to 3 hours. And it's okay if you are. Listen to your body. In most cases, it doesn't lead you wrong. Pregnancy is a different state of existence for you daily. And sometimes, yes, your body is saying, I need more fuel and give it to me. And yes, you might be snacking more than normal. And let's just try and make sure that it's healthy snacking, good things going in, but feeding what your body is trying to let you know that it needs. Exercise. Yes, we want you to continue to be active. There should be some limitations and reasonable adjustments as you're growing. Your belly's getting bigger, and everybody, I know what they're into. Can I do treadmill? Can I do the stationary bike? Can I do Peloton? Get it all the time. Yes, but you have to listen to your body. If you overdo it, if you stretch too much, if you lift too much, you start getting crampy, and pregnancy is going to be different. You're going to immediately think, is my baby okay? Am I contracting? Is this preterm labor? So I tend to counsel patients on, let me meet you where you are and what you're currently doing. And let's make adjustments as you start to have signs that we may need to scale things back. But absolutely, remain active. Prenatal yoga is a good one. You can do modified Pilates, yoga, treadmill, outside, light jog, absolutely. And the stationary bike, you can do that.
Can you explain the importance of prenatal vitamins, and particularly folic acid and other supplements that really are key nutrients that pregnant women should be taking?
This is the thing that you want. It's like when we say, hey, take a multivitamin every day, and you know that you're transitioning to trying to have a baby, you start thinking in terms of putting things in then that are best for you and for growing pregnancy, and having those things on board for when you do have that positive pregnancy test. So a good prenatal vitamin, and sometimes right now you're starting out over-the-counter options. There's some good one-a-day options, Nature's Made, absolutely. It doesn't have to be prescription prenatal in the beginning or ever. There's some good options out there that you don't need a prescription for, but trying to be consistent with that. And if you find that you can't tolerate it, the pill's too big, the smell it makes your nausea worse, so you take a gummy. Gummies are okay, but you're only having to do 3 to 4 of those a day. And sometimes they're missing some key nutrients or levels that we want you to get. So transitioning transitioning to a good prenatal, good amount of folic acid. Basic is about 0.6 milligrams for your low risk patient. But for those that have a history, that's a little bit more complicated. We would recommend a higher dose. Getting that in, and you're doing that, and it's in that prenatal to foster good brain development, spinal cord development. We want to minimize the risk, and folic acid decreases that risk by about 70% of some brain malformation. And there are other things related to, but neural tube defects is what you're going to see if you go online, you look at folic acid. Let's bare bones here. Spinal cord, brain, yes, we want folic acid on board for good development.
And some other things that we want to talk about, especially right now when the heat is on.
Yes.
Talk about the effects of heat on not only the developing fetus, where it can affect the neural tube development, but what other things have you seen?
You can't heat in pregnancy while your body's trying to take care of you and a growing baby. Much easier for you to get dehydrated, and you think I'm hydrating well enough. In most cases, you need to be hydrated more, especially in a hot state. Temperatures upper 90s, lower 100s. Hydrate. Why? It kind of goes back to that exercise conversation or question we talked about. Your uterus is a muscle, and you get dehydrated, that muscle gets cranky and angry. And what are you going to do? You're going to start cramping. And you're like, oh my gosh, what's happening? Am I going into early labor? Is my baby okay? Hydration, avoiding extreme temperatures for prolonged periods of time absolutely should be a focus. And you can do your trips and be out in the sun, but within reason. And just not allowing that to maybe precipitate a symptom that's going to cause more fear and anxiety for you. Mm-hmm.
So true. What are some of the warning signs during pregnancy that women should never ignore?
Number one, persistent headache that will not go away. You've rested, you've hydrated, you're eating well, you took Tylenol, you took magnesium, you maybe even drank a little bit of caffeine, and yes, it's okay to do that, and it just will not resolve. That is probably elevated blood pressure until proven otherwise, or something else neurological going on. The other one that I try and keep at the top of the list for any patient, worsening shortness of breath. And this is one you don't see it often, but there are respiratory and cardiovascular things that can happen, i.e. lung and heart things that can happen, that pregnancy can make you more predisposed for. They're rare, but when they happen, that shortness of breath that you're trying to get out of the car and walk to the front door of Target, and you're huffing and puffing a little bit more, then you need to ask the question, is this normal? Should we be doing more workup? And one other that I'll throw out is swelling of your legs that is just out of proportion to what should be swelling just because I'm pregnant. Like you're the Michelin lady, okay? You're puffy, face is puffy, hands, legs, and any swelling that is one-sided. Right leg bigger than the left. That's not normal. That is a blood clot until proven otherwise. And so those are probably my top three: headache, worsening shortness of breath, and swelling that is favoring one side versus the other.
Do you recommend aspirin for women who are pregnant, baby aspirin?
Very good question. My colleagues and I kind of joke sometimes, talk about a prenatal vitamin. We're probably going to start adding aspirin to the prenatal vitamin, or saying take it, it's the combo. For a large majority of patients, when we look at the risk factors that can predispose you to being at higher risk for blood pressure problems in pregnancy, preeclampsia, gestational hypertension, we have high risk, moderate risk, low risk. If we look hard enough, we can probably find a couple of things for most of the patients that we're taking care of. So yes, it is safe to do. It has been shown to significantly decrease risk of developing blood pressure issues in pregnancy. And just talking with your provider more about where do you risk out and pros and cons, but absolutely have that conversation.
Thanks. Talk about some of the common pregnancy discomforts like nausea, morning sickness, back pain.
Oh. The nausea, vomiting for most tends to get better after the 14 weeks when you transition into the second trimester. But when it is happening and you think, will this get better and you're trying to tough it out.
Ever.
Ever, right? And for some people, it doesn't. That, again, that's the rarity. But a lot of patients, we can control it or at least make it manageable with things like ginger, vitamin B6, Unisom or doxylamine. It's a sleep aid. There's some medications that have combined those two, vitamin B6 and the Unisom together. It's category A, safe in pregnancy, been studied. We don't have to say risk, it is safe to do it. And so we can kind of separate those out sometimes and use those. Again, there's some prescription things that we can use. And it's kind of counterintuitive. Like, you don't think this makes sense, but I promise you it does. Sometimes eating and feeding your body when it's telling you to allows that stomach acid that can create more nausea, more vomiting. Give your body some food. It'll quiet it down and a lot of times help improve those symptoms as well. Back pain, carpal tunnel, restless leg, muscle spasms. Yes, pregnancy is not nice in that way sometimes. And so massage, prenatal massage. It goes back to the exercise, the yoga, the stretching, elevating the feet when you sleep, the legs, when you sleep at night, massaging the legs, getting into a routine of end of my day. Let me focus on things that are going to tell my body, quiet down. I want to sleep while I can because I know I'll be up at 2 a.m. going to the bathroom to pee. Okay. But to be expected. And just along the way, when you're met with those things, talk to your provider about, hey, this is what's going on. What are some non-prescription, very kind of minimal intervention types of things that you can do to make part of your routine to help you get through those things.
It also sounds like that's something your partner could help with, the massage.
Yeah. Mm-hmm. I look over at they come to the visits and, their significant others sitting in the chair, and I look over and I say, okay, I see those hands look like they could do a good job. And that support person, whomever they may be, absolutely bring them into the fold in that way, because they're a lot of times trying to figure out how can they help you when you're going through having those symptoms. And they, I hope, love you and respect the job you're doing carrying this child, and that's one way they can help.
Yes.
Yeah.
So I've been known to recommend that pregnant women have their COVID vaccinations and stay up to date on their COVID vaccinations. Would you agree?
Absolutely. And would I dare disagree with Dr. Walks? Absolutely not. Would not do that. But it is, the COVID vaccine we have so much information and data supporting its use and the need to recommend it at any point in pregnancy. There's not a particular timeline where you should get it or should not get it. And we know that it decreases the chance that the mom gets COVID. It decreases the severity if she does. It's been shown to decrease preterm birth rates, and those are all good things. And it increases the chances your love bug will be born with some antibodies against COVID, and that's only more protection for them as babies.
And that's what we want. Could you discuss the pros and cons of different birthing options? There's so much on social media, and then your girlfriend says that she kind of heard that her cousin, that kind of thing.
I tell you, this one here, I don't want to get myself in trouble with folks that follow me on social, but we would be doing, I think, a disservice to those that we have committed to take care of if we don't. And I'd say give some pushback. I mean, it's time. I mean, this has really gotten out of hand. And I think it mirrors what we are seeing in society in general, an extreme response to most things that we're being faced with, and the extreme extent to what I'm seeing with patients and their reliance on social media, Google, TikTok, YouTube, to be their source and guide. It's disappointing. It's not what any of us who do this day in and day out in an OB. I have 2 patients I'm taking care of. And I was talking earlier about if I had to use a visual and say, before I talk about the different birthing, options, let's talk about the visual of what we need to keep in mind. If I'm a pilot on a plane as the OB, and you have the doula, you have the midwife, you have home birth option, birthing center option, then you have the hospital option with an OB. If I'm the pilot on the plane, there are some people that should serve a role as a flight attendant. There's some people that should serve a role as a co-pilot. But when you rely on that plane to make it to its destination, there are certain people that you're not going to look to do that for you. You're going to let me fulfill the role I'm supposed to fulfill. And I ask that when you're looking at the option that may be best for you, choose that option that you can be comfortable that the role that that person is intended to play for you is one that is okay. So it takes some research to say, am I a home birth patient? Am I a birthing center patient? Or am I a hospital birth patient? And what does that mean? And that comes back to that preconception visit, that preconception look at your options. You may be too high risk to do one of those options. You may be a little too nervous not to be in a setting where if you needed, I don't know, a blood transfusion or pain, you don't deal with pain very well. Do you really think you could do it without maybe an epidural? And epidurals are not the devil. I'm an OB and I'm not the devil. Okay. I want good outcomes for all patients. I think we all can say that, but we have to make sure that we're guiding patients towards information that is more accurate and true, meets them where they are, and doesn't skew this experience to pit the flight attendant, the pilot, the co-pilot against each other. The team approach is best. And I'm afraid that what is out there is creating these silos of separation, and that's leading to more misguidance. And so I think that kind of covers more of the con side of the options. The pros is that it's not one size fits all. And the patient that I might think I'm a good fit for, trust me, there's some patients I know that I'm not. And I need to own that when I see that and help that patient see where another option may be a good option for you. And if you are going to be with me, there are some things I do think a doula could bring to your birth experience, but we again are a team working together, and you've chosen me to be the pilot and get you to that destination. Healthy baby, safe delivery, and both of you going home in 2 or 3 days and not being readmitted with something. That's what you look to me for.
That's the goal.
That's the goal.
And so collaborating at the preconception appointment throughout those prenatal visits, and then knowing when it comes time and you're at that home stretch that you've made the right choice. Yeah. What advice do you give to women who are pregnant with regards to managing stress and their mental health? I know diet, I know exercise and sleep.
Yep. Exercise, sleep. I think not forgetting that everybody is at risk for, while you're pregnant, being depressed, having more anxiety, or having an exacerbation or worsening of a condition you've been dealing with your whole life. Your depression symptoms don't go away because you're pregnant. They don't go away because you chose to stop your medicine because I'm pregnant, I don't want to take my medicine. That's not always the best thing to do. I think owning that everybody's at risk for it, and finding ways that, is it talk therapy that I need more now to help me traverse this better? Is it increasing my medication dose to help me traverse this better? And not putting those concerns on a shelf or limiting how you want to approach them out of fear of what could be, not work well for baby. In most cases, I'd much rather treat worsening mood disorders than ignore, than not treat or undertreat, because the benefits are going to far outweigh risks, because we have safe options. We have, therapy options. We have safe medications, in quotation marks. A lot of data to support that you can and should be doing the things to keep you from spiraling 2 weeks before you deliver, 3 weeks after you deliver, 6 months after you deliver. I've been there with patients before, and I've learned over the years, try and stay ahead of it. To bring someone back from crisis with something that they really cannot control is daunting, and you can't be there fully for your baby, fully for your family. And it's a hard thing to watch because we can't discount it and minimize it. It's too far reaching.
Because the mind, body, soul are all connected.
All connected.
And all collaborating.
Collaboration.
Yes. So how can women prepare for those postpartum changes that they're going to have? That's kind of a segue from what we were just talking about, really, because those blues, the baby blues, you see things transitioning leading up to you haven't had the baby yet. Start having those conversations beforehand to try and get ahead of things before the newness, if you want breastfeeding, the vaginal pressure, is the bleeding going to stop? Oh my gosh, I have to go to the bathroom and I can't hold it at all. You're trying to go to the bathroom, breastfeed, get back and clean whatever the case may be. It can be overwhelming. And so making sure you're in the best mental state that you possibly can be in before you have the baby, or if all is well and something comes up, address it as soon as possible afterwards. And looking to do things just how you want to prepare leading up to, prepare for the after. Lactation consultations, having someone lined up if you can. There are several community-based programs. There's several just free access type of programs for any and everybody to have support, whether it's doula postpartum, someone to come in, you just need to take a nap. Or you need someone to say, okay, the baby's latch is okay right now, but let me show you some other things to maybe help increase your milk production. So I think lactation, postpartum support options, and then I'm going to throw out pelvic floor physical therapy. Yes.
Okay. When we talk about preparing.
Oh, yes.
Yeah. You got to live with leakage. No, you don't.
No, you don't. And that works. It works. Yeah.
So those are probably my top three that have gained more momentum, and people are talking about them more, so that the postpartum transition, seeing it as still a work in progress that doesn't end at 6 weeks when you have generally your last postpartum visit with me. There's much to be done, especially in that first year.
I think we'd be remiss if we don't talk about the role that our partners play in supporting our pregnancy, supporting the postpartum period, and just helping us along the way.
Absolutely. And I find so much value in having that partner, that support person, whoever it may be, come to some of the visits, even if they can't make all of the visits, because the 10 minutes, 15 minutes that you have in the room with your doctor, a lot of times I'll look to the partner and I'll say, is there something she's been complaining about at home that she's forgetting to tell me about? They're another set of eyes and ears. And you may have forgotten that 2 weeks ago, you did have an episode of a horrible headache. You just went to sleep, but you had it for 3 days. Or your mood is changing. You don't see it, but someone who's living with you day in and day out, or interacting, with you in that way, I'm not all the time is going to see that in our time together. And so a second set of eyes, ears that wants the best for you and that baby, they play that another voice, another person to bring information to the table. And then I always like to tell them sometimes too, if you're scared about the process and pain, especially, or when you are kind of fed up with something that's happening in the process, get a code word. When you just can't explain it and you really don't want to bite their head off, like scream at them during the process. If I say pineapple, you know what pineapple means. We talked about pineapple. And they'll look over and they'll say, she said pineapple. And she said, when she says pineapple, it means fill in the blank, things like that. It keeps them involved, engaged, and you looking to someone else to serve as a voice for you when the unknown of the labor process can get a little stressful in the moment. And if they can't,
then you have a doula.
You have a doula that you brought along with, and we've created that team approach, and that's where I think it's so key. You know your partners better than anybody, and what could be too much for them or not. If you want them just there to kiss you on your forehead, okay, you might need somebody else in the room then, okay, to tell you can do it, or to tell you, hey, this, we talked about this, and you said if we got this is what you're going to do. If your partner can't do that, get somebody who can. and get someone who can, not a new partner, but a support person. Let me be clear.
Thank you so much for being our guest today. You can find Dr. Berry Roberts online at her website, www.docwholistens.com. Tag her with your questions on social media at #DocWhoCares.
Yeah, Doc Who Listens.
Yes, thank you. That's all the time we have for today's episode of Health Talk. Thank you to KAZI 88.7 and to St. David's Foundation for their support of this program. Until next time, take care of yourselves and each other. This is Dr. Desmore Walks signing off. Be well.